So inflammatory bowel disease, we call it IBD, affects about 250,000 people in the UK. Two most common types are Crohn's disease and ulcerative colitis. Now we know that fatigue is a common problem and it affects about 40% of people with IBD.
I first noticed fatigue was a big part of the symptoms of my Crohn's in my 20s. I found that I used to get quite tired quite easily.
It's like an uphill bicycle trip sometimes. You're just pedalling away, but you're just permanently exhausted.
What's become clear is that a lot of patients still have fatigue, even when the doctors and nurses think that the disease is in remission.
It's kind of the forgotten symptom, as it were. So you have to explain to people, and often explain to the doctors, you know, well, okay, I feel okay, but I'm just really tired all the time. And that's, sometimes they won't know what to do.
I think IBD nurses and doctors can often feel very frustrated that they can't do more or offer more help. That's why the research that we've been involved with and is ongoing, I think, is going to be very important.
One of the problems that we've had with fatigue is it is what the patient tells you. It's rather like pain. It's difficult for us to make clear judgments on that without there being some quantification. So what we've done is to work on a list of things that are likely to be an explanation for fatigue that could be readily identified by simple testing and with a possibility for treatment.
So to check that nothing that could be reversible has been forgotten, that healthcare professionals are thinking about this more systematically and checking that all the right tests have been done. We've produced a 4-page document, and there's an online version as well, where people can get a fatigue scale score to help people score how bad their fatigue is and its impact on their lives.
It allows us to begin to put numbers on things. It allows us to compare people. It will allow in future trials to try and put a bit of objectivity into an assessment of something that is by its very nature rather subjective.
The main hope that I have for the scale is that it will empower patients in order to make the symptom of fatigue real, will allow them to assess themselves in terms of how fatigued they are, and that will be a stimulus for patients to talk to their healthcare practitioners.
I've had a look at the fatigue scale and I find it really interesting because there was points raised as part of the rating scale that made me sort of realise just how much the fatigue really affects me.
I think the questions that are in there seem pretty sensible in terms of the kind of trigger conditions and the things that you should be looking out for.
For somebody like myself who perhaps needs to give more recognition for the symptoms of fatigue, so having something like that really does make you acknowledge your fatigue symptoms.
You can look at it and say, well, this is the reason why I'm feeling terrible. Is there a way I can work around it or change things to get things better?